Back to work. More party time. Okay. So, earlier today, when I was looking and thinking about the Jackson 5 singing the ABCs, I was thinking how wonderful it would be if people would pay attention to the ABCs all the time. Not only am I talking about with reading and writing, but I'm talking about the keys to managing your diabetes and hopefully preventing, minimizing, or delaying the complications of this disease. So let's look at the ABCs of diabetes management. The first one is A equals A1C. Your A1C is the measure of your blood glucose. It's the average over about 3 months. And most people think about their A1C as is their goal, and it's a target that's set between you and your physician. The American Diabetes Association thinks that your A1C should be 7 or below. And so that would be a good goal to strive for. And the way that you can accomplish that is by eating healthy, eating balanced meals, taking your medication, and moving more, and working on that A1C. The B of the ABCs of diabetes management is managing your blood pressure. Managing your blood pressure is so important because people who have diabetes have an increased risk of heart attack and stroke. An elevated blood pressure or hypertension can lead to kidney problems, vision problems, blood vessel problems, heart attack, and stroke. So just like with your diabetes medications, you also need to take your blood pressure medications if you're prescribed them from your doctor. You need to make sure that this is one medication that you don't run out of. The other thing is, again, eating a healthy diet, watching your sodium intake, and reading labels and knowing how much salt is in the food that you're eating is so important. The C of diabetes management is cholesterol. Knowing what your cholesterol levels are, again, setting a target with your doctor, taking your statins or your cholesterol lowering medications if you're ordered them, and again, not letting this be a medication that you run out of or that you don't take. Basically, when we think about fats that are present in food, we think about saturated fat and unsaturated fat. Unsaturated fat is the fat that you should be eating and trying to stay away from saturated fat. Again, reading your food labels and understanding the differences that fat plays. There's a couple of different kinds of lipids, your HDLs and your LDLs. Your HDLs I like to call the hero, and those are the ones that you want to elevate, and your LDLs are the ones that I call the loser, and those are the ones that you want to lower. HDL raising foods are things like nuts, avocados, olives, olive oil. Again, exercise plays a key part in all of these things. So once again, your A1C, 7 or below. Your B for blood pressure, 130 over 80 or below, or whatever target range your doctor sets for you. And C, your cholesterol, watching your cholesterol, making sure that it's 200 or under, or whatever target range your doctor sets for you. And moving more, that's where it's all at. So let's get back to ABC.